If you've ever felt muscle tension for no apparent reason or had a headache out of the blue, the cause could be something you're doing every day but just don't know it. This morning on Health Watch, 5 surprising pain triggers in your daily routine. And here with the pain truth, Dr. Kavita Mariwalla. Great to have you with us, Dr. Mariwalla. And one of the things that is on our table here, and it's here for a reason, is the wallet. And your wallet could actually be causing you pain.
That's right. So a lot of men carry around a big wallet and they put it in their back pocket. It ends up resting on the piriformis muscle, and that's where the sciatic nerve runs. So you sit in the car, you're sitting on the wallet, and you can end up getting sciatica. So you can get shooting pains down your leg. If that happens, the best thing to do is do Advil or Aleve and to do some hot and cold packs. But keep that wallet in your jacket pocket, especially if you've got a long commute.
Yeah, and also it's just a good idea to do for those people who might want to come up and take it from you. It's harder to get out of your breast pocket.
Exactly.
Other things that can cause pain. One of them is food, the cheese and the wine that we have here.
Exactly. As a food lover, I hate to say it, but cheeses can actually give you a migraine. So hard cheeses that are aged produce tyramine, and tyramine is known as a migraine trigger. For red wine with tannins, you can also end up getting headaches. So you want to stick to white wines, and if you must have red wine, you can go for Beaujolais or a lighter bodied Pinot Noir.
So stick to something lighter if you must have your wine, or
white wine.
Try some white wine.
Exactly.
Should you be treating this with Advil? Is that something that makes sense?
Typically with migraines, you want to do something like a caffeine and Advil combination. That's the best stuff for migraines. And keep a food journal, because then you'll know what's actually causing the headache and you can actually pinpoint the food itself.
I know this feeling from sitting at a workstation. Your back starts to get sore, your neck starts to get sore.
So we always think that the desk job is so safe, but actually it's a place where you can get a lot of overuse injuries. So you're sitting at the computer screen, you're hunched over, you get back pain. You're straining to look at the computer monitor, eye strain and headaches. And also when you're typing all the time on a flat keyboard, you can actually get carpal tunnel. So the best thing to do is when you're sitting, have good posture. Feet on the ground, monitor at eye level. Keep that monitor at a good brightness so you're not straining your eyes. And think about bringing some lamps from home to make your work area brighter. As far as the keyboard goes, you can use a gel pad right by the keyboard to rest your hands on and elevate those little legs at the back of the keyboard so your keyboard's tilted.
Oh, tilted keyboard helps things. Sleep habits. You know, you talk about posture at your desk, but there's also something to be said for posture while you sleep.
Exactly. So, you know, doctors affectionately call it the Saturday night palsy because people come home and they just kind of pass out and fall asleep in all kinds of positions. If you're a stomach sleeper, you can end up getting neck pain because you constantly have your neck rotated. If you sleep on your arm or your elbow, you can actually get numbness and tingling. So they say that the best way to sleep is on your back if you can, and if you need to sleep on your stomach, try to put a pillow between your knees and your ankles and try to rotate on your side.
Lastly, the new smartphone syndrome, the thumbs. I do have this issue where you send too many text messages or too many emails on your smartphone, and all of a sudden you feel a really big sense of pain.
That's right. We're all addicted to texting nowadays, and you can actually get arthritis in the thumb joint. We're seeing it as early as age 30 now. The best thing to do is, if you can, stop texting to give your hands a little bit of a rest. But if you really can't, use a tennis ball and squeeze that in your hand a couple of times a night. It'll actually help strengthen the muscles in your hand so you can text all you want.
And if the symptoms continue to occur, go see a doctor.
Absolutely. There are a couple of things that can cause pain that you should not miss. So number one, chest pain. If you have tightness in the chest, like an elephant sitting on it, or if that pain is radiating down your left arm, you want to go to the emergency room. If you feel like you're getting the worst headache of your life, that's also a reason to go see a doctor. And if you're developing numbness or tingling in any extremity, in addition to back pain, you want to go see a doctor.
Well, Dr. Kavita Mariwalla, we're so glad you could be here to enlighten us with this stuff, really useful stuff. And for more on unexpected sources of pain, go to our partners in health, webmd.com, and search pain triggers.